In a world where millions grapple with the devastating effects of cancer, a beacon of hope has emerged from the halls of medical research. The potential to detect this formidable disease long before it casts its shadow on an individual's life is no longer confined to the realm of science fiction. A recent breakthrough in oncology has unveiled a revolutionary method that could change the trajectory of cancer care forever. By harnessing the power of blood tests, scientists have taken a monumental step toward early detection, offering the promise of saving countless lives and transforming the way we approach one of humanity's most persistent adversaries. The implications of this discovery are profound. Cancer, often detected at advanced stages when treatment options are limited and outcomes uncertain, could now be intercepted at its earliest moments. This new frontier in medicine opens up a window of opportunity, 3 years' worth of time, to intervene, treat, and potentially cure the disease before it becomes a full-blown crisis. The idea that such a simple blood test could serve as a powerful tool in the fight against cancer is nothing short of remarkable. At the heart of this innovation lies the understanding that tumors do not operate in silence. As they grow, they shed fragments of their genetic material into the bloodstream. These microscopic traces, once invisible to conventional diagnostic tools, are now being captured and analyzed with unprecedented precision. Through the use of highly sensitive sequencing techniques, researchers can identify these telltale signs of cancer hidden within the body's own circulatory system. It is akin to finding a needle in a haystack, but with the right technology, even the smallest anomaly can become a significant clue. This development represents a paradigm shift in how we perceive and manage cancer. Traditionally, diagnosis has relied heavily on symptoms, imaging scans, and invasive procedures. While these methods have served us well, they are inherently reactive, waiting for the disease to manifest itself before taking action. In contrast, the new approach is proactive, aiming to catch cancer in its infancy when it is still vulnerable and manageable. This transition from reactive to preventive care marks a critical turning point in the history of oncology. The process of identifying these early signs of cancer through blood tests is both intricate and fascinating. The blood samples used in the study were initially collected for cardiovascular research, highlighting the serendipitous nature of scientific discovery. What began as an exploration into heart health unexpectedly led to groundbreaking insights into cancer detection. This underscores the interconnectedness of various fields within medicine and the importance of interdisciplinary collaboration in advancing healthcare solutions. As the researchers delved deeper into the data, they uncovered something truly extraordinary. Among the participants who later developed cancer, some showed evidence of the disease in their blood samples years before any clinical symptoms appeared. This revelation was both surprising and exhilarating, as it demonstrated the immense potential of the multi-cancer early detection (MCD) test. The ability to pinpoint the presence of tumor-derived mutations so far in advance is a testament to the power of modern genomics and bioinformatics. The significance of this 3-year lead time cannot be overstated. In the world of oncology, timing is everything. The earlier a cancer is detected, the greater the chances of successful treatment and long-term survival. During those precious years, doctors can monitor the patient more closely, initiate lifestyle changes, or even begin targeted therapies that may halt the progression of the disease. This extended period also allows for the development of personalized treatment plans tailored to the unique genetic profile of each patient's cancer. Such precision medicine approaches have already shown promising results in improving outcomes for many types of cancer. Moreover, the simplicity of the test adds to its appeal. Unlike traditional diagnostic methods that often require complex procedures and lengthy waiting times, a blood test is minimally invasive, quick, and relatively painless. This accessibility makes it an ideal candidate for routine screening programs. Imagine a future where annual physicals include a basic blood draw that could alert individuals to the presence of cancer long before they feel any symptoms. This scenario is no longer a distant dream but a tangible possibility on the horizon. However, the journey from discovery to widespread implementation is fraught with challenges. While the initial findings are encouraging, further research is needed to validate the effectiveness of the MCD test across diverse populations and cancer types. Scientists must also address concerns related to false positives and the psychological impact of receiving a positive result without a confirmed diagnosis. Additionally, there is the question of cost and availability. How can such a transformative test be made accessible to all, regardless of socioeconomic status? Despite these hurdles, the potential benefits are too great to ignore. The ability to detect cancer at its earliest stages could significantly reduce the burden on healthcare systems by preventing the need for expensive and aggressive treatments in later stages. It could also alleviate the emotional toll on patients and their families, offering them peace of mind and a sense of control over their health. Furthermore, early detection aligns with the growing emphasis on preventive medicine, which seeks to shift the focus from treating illness to maintaining wellness. The ethical considerations surrounding this technology are equally important. As with any medical advancement, there are questions about privacy, consent, and the responsible use of genetic information. Ensuring that individuals understand the implications of undergoing such a test is crucial. Clear communication and robust counseling services will be necessary to help people make informed decisions about their health. Moreover, there is a need for policies that protect against discrimination based on genetic predispositions, ensuring that everyone can benefit from these innovations without fear of repercussions. Looking ahead, the integration of this new testing method into existing healthcare frameworks will require careful planning and coordination. Healthcare providers, policymakers, and researchers must work together to develop guidelines for implementing the test, interpreting results, and managing follow-up care. Training programs for medical professionals will be essential to ensure that they are equipped to handle the complexities of this emerging field. Public education campaigns will also play a vital role in raising awareness about the importance of early cancer detection and the availability of new screening options. The story of this breakthrough is not just about a single test or a specific group of researchers. It is part of a broader narrative of human ingenuity and perseverance in the face of adversity. From the moment the first microscope revealed the existence of cells to the latest advancements in gene editing, our quest to understand and combat disease has been marked by relentless curiosity and determination. Each discovery builds upon the foundations laid by those who came before, creating a legacy of knowledge that continues to evolve. In this context, the development of the MCD test serves as a powerful reminder of what can be achieved when science, technology, and compassion converge. It is a testament to the tireless efforts of countless individuals who have dedicated their lives to unraveling the mysteries of cancer and improving the lives of those affected by it. Their work has brought us closer to a future where cancer is no longer a death sentence but a manageable condition, if not entirely preventable. As we stand on the brink of this new era in cancer care, it is important to remain optimistic yet realistic. While the prospects are exciting, we must continue to support ongoing research and advocate for equitable access to healthcare innovations. The road ahead may be long, but the destination, a world where cancer is detected early, treated effectively, and ultimately eradicated, is worth every step. Together, we can turn the tide against this formidable disease and pave the way for a healthier, brighter future for generations to come. As we wrap up this eye-opening journey into the future of cancer detection, it's clear that we're standing at the threshold of a medical revolution. The idea that a simple blood test could detect cancer years before symptoms even appear is not just groundbreaking, it's life-changing. Imagine a world where cancer doesn't sneak up on us in its most aggressive form, but is caught early, when it's still small, manageable, and potentially curable. This isn't just science for the lab anymore. It's science for the people, science that could become part of our everyday healthcare routines. Picture your next annual checkup. Instead of waiting for something to go wrong, you get a proactive look at what might be coming. You get time. Time to make choices. Time to act. And maybe, just maybe, time to prevent something devastating from ever happening. Of course, like all great discoveries, there are challenges ahead. This technology needs to be refined, tested widely, and made accessible to everyone who needs it. But the potential is enormous. It's about more than just detecting cancer, it's about shifting the way we think about health, from reactive to preventive, from fear to empowerment. So, as we close out this video, I want to leave you with one thought: change is coming. And it's coming fast. The future of medicine is already here, and it's being written in the smallest fragments of DNA floating through our blood. What matters now is how we choose to use it, for ourselves, for our families, and for the generations to come. If you found this information valuable, don't forget to hit that like button, subscribe to the channel, and share this video with someone who might find it helpful. Because knowledge is power, and when it comes to something as serious as cancer, staying informed could very well save a life. Thank you for watching, and stay tuned for more updates on the latest in science and health.